And greetings to everyone who is joining us today. This is such an urgent and obvious, a classic example of a low-hanging fruit problem. We know without clean water and soap, you don't have hygiene. It's just A plus B equals C. When I walked into the Kikwit General Hospital in 1995 in the middle of the Ebola outbreak, I was stunned that there was no water at that hospital and that the way they sterilized instruments between surgical procedures was in a giant cauldron over a bonfire, simply boiling them for whatever amount of time was possible before using them on a patient. The doctors themselves had no way to wash their hands. And so, not surprisingly, Ebola in that region was primarily spread within hospital settings, within the very settings that are meant to save lives. All over the world, we see that roughly 16% of healthcare facilities lack any serious clean running water, which is absolutely an astonishing finding. SDG number 6 would have addressed this, but here we are in a magnificently enormous recession, pandemic, global economic crisis. And because of this crisis, and here we are virtually meeting instead of in the hallways of the United Nations, we are all hard pressed to address any great visionary tasks right now. Money is scarce, solidarity is even scarcer. And whether SDG 6, bringing safe water to the entire world population, will be realized as anybody's guess. Right now, it doesn't look promising. Some 3 billion people simply can't wash their hands. So the very pandemic that is putting all our efforts in peril because of the lack of solidarity and a lack of resources is spread because of the problems we can't address. Hand washing. And of course, it's more than just water. You can't get rid of the COVID SARS-CoV-2 virus without soap. So lacking water also must mean, do we have soap to address the problem? About half of school children around the world are probably not in classrooms right now because of COVID, but half of those who are in classrooms are in schools that lack any hand washing facilities for those kids. As we look around the world, we can see multiple disease crises affected by this lack of appropriate hand washing capacity and safe water for hygiene. It's not just COVID, it's cholera, it's Shigella, it's influenza, it's a long list of diseases. We cannot address health security and improve the survival of humanity and decrease the threat of pandemics if we fail to deal with this crucial hand washing crisis. According to the WHO UNICEF Joint Program for Water Supplies, Sanitation, and Hygiene, 4.2 billion people have no access to water for sanitation on a routine basis. 3 billion can't even get their hands into a designated hand washing facility to appropriately sing happy birthday twice while scrubbing their hands with soap to kill the COVID virus. Even here in the United States, the richest country on earth, 2 out of every 5 urban residents are unable to pay their water bills and ensure that they have safe water to wash with and drink in their homes because our water bills have increased by an average of 80% since 2010. All over the world, we're seeing water scarcity, that the cost of water is higher, not just a financial cost, but a distance cost for children to walk in order to collect water and bring it home on their heads, a cost in lost school time for those very children, a cost in agricultural time as you try to rationalize which water goes to feed the crops, which goes to clean the homes and the children. All of this means that this conversation is absolutely paramount. You can't stop a pandemic if you don't have the ability to clean your hands. I welcome this conversation and congratulate the organizers for bringing it to the attention of the United Nations and the entire global community that is able to observe this at this time. Thank you very much.